Hello, my name is Noelle Q, and today I'll be telling you about universal healthcare, a system that provides health insurance to all citizens. More than 1.1 million Americans using Medicare will die over the next decade because they cannot afford to pay for their prescription medications. The current healthcare system is inequitable. Private insurance results in a hierarchy of levels of care based on your ability to pay. About 46 million Americans have no health insurance at all, and the United States spends more on healthcare than any other country. In our privatized healthcare system, many citizens are unable to access primary care physicians and preventative medicine due to their inability to pay. As a result, these citizens rely on the emergency room as their primary medical care. On average, one emergency room visit in Illinois costs $1,818. Emergency room visits are expensive, and by the time someone needs emergency medical care, their health issues have worsened. That's why, despite spending more on healthcare than any other nation, Americans have poorer health when judged by the number of preventable deaths that take place in our country every day. Dr. Stefan Schoenbaum, Director of Commissions on a High-Performance Health System, says, "If our healthcare is supposed to help us have longer, healthier, more productive lives, we're just not doing as well as we should be." He has also said that the current system is contributing to our national indebtedness, eroding our wages, and hampering our ability to deal with critical issues like education and infrastructure. About 17% of all spending in the U.S. pays for some form of health care, money that might otherwise be spent on schools, roads, and pensions. My brother Ryan was born with a congenital heart defect. He has had 3 open heart surgeries so far and will need other procedures in the future since his artificial heart valves calcify over time and need to be replaced. He is 20 years old and will soon be too old to remain on our parents' insurance plan. If the Affordable Care Act is repealed, private insurance companies will deny him coverage due to his pre-existing condition. He will have to choose between bankruptcy or an untimely death through no fault of his own. Many resources exist to help you understand the basics of healthcare reform. Healthreform.gov is a site from the Department of Health and Human Services, and the Kaiser Family Foundation is a nonprofit group that focuses on healthcare issues in the U.S. In addition to educating yourself on the topic, I need you to write or call your elected officials. Politicians look to you for guidance, so let them know what you think about our universal health care.